A pleasant good afternoon to you, and it is such a pleasure to be back with you on yet another episode of Health Solutions Made Simple. This is brought to you by our brand Health and Communication Solutions Limited, based here in Dominica. This afternoon, we are going to focus a bit on diabetes and its link to yeast infections. So, many of us know of diabetes as one of the chronic non communicable diseases that includes elevation of blood sugar or blood glucose. We know of many of the complications that is caused by diabetes, such as kidney failure, blindness, amputations, and the list goes on. However, do you know that if you're diabetic, that increases your risk to frequent yeast infections, particularly if your glucose levels or sugar levels are not properly controlled? So, basically, as we said, the aim of any patient that has been diagnosed with diabetes is one, to be aware of your medical condition, learn as much as you can about the medical condition, then the management, adhering to the management of diabetes, both from a dietary standpoint and a medication standpoint, the medications that we prescribe to you, lifestyle modifications, and so forth. So, diabetes, especially when poorly managed, increases the risk of yeast infections. Why? Because sugar feeds on yeast. And yeast is one of the microorganisms that lives in our body and on our body. And what it does is that it weakens the immune system, making it harder to fight infections. So, as we know, as our glucose levels increases, it can lead to more glucose secretion, and therefore we can even have glucose secretion even in our urine, providing a rich environment for yeast growth and, more specifically, that particular yeast called Candida albicans. Now, this is one of the main yeasts that is found on the skin and in the body, and if left uncontrolled, it can cause what we call candidiasis. Candidiasis, and so you find women are often told that you have a yeast infection in the vagina, or you may have what we call thrush in the mouth, which is also the same candidiasis that give rise to that thrush in the mouth or inflammation in the mouth, and you would have to be given treatment for it. So, what do you do? Generally, the aim, as I said, is to one, control your glucose levels, two, maintain good hygiene, because as we said, because if the glucose levels are very high, it can begin to seep through your urine, and so every time you urinate, then that excess glucose now sort of some way somehow the yeast that's in the vagina or on the foreskin of the penis will begin to feed onto that sugar, and therefore would cause an inflammation, and that inflammation will give rise to an infection if not treated promptly. And so you want to maintain good hygiene. You want to wear preferably breathable clothing. When we talk about breathable clothing, we're talking about not the synthetic material, so not nylon, not polyester. We're talking about preferably cotton clothing or linen clothing. Those are more breathable. You want to stay hydrated, of course. You want to change damp clothing. So let's say you have gone to the gym and you are sweaty. You want to try to get home as soon as possible to get rid of that damp clothing, as it's going to make your skin and the body more favorable for the growth of yeast. Now, there are also a particular class of medications that can also increase your risk to candidiasis. Yes, this particular class of medications, they help to control glucose levels, but in some cases they can also cause a slight sort of adverse reaction when taken. So we have the group of drugs called the SGLT2, and that is SGLT2 inhibitors, and those are what we basically call sodium glucose co-transporter type 2. So what these drugs basically do is that they work by making the kidneys excrete sugar into the urine, which when that sugar now passes through the urine, it now can produce the right fuel or environment for the yeast to grow, particularly in the groin area. So yes, I know that there is this big debate as to should men shake their penises after urinating, or should they wipe. We recommend wiping, merely because it is more absorbing than shaking, because you particularly if you're diabetic and your sugar levels are high, you may not even recognize that, as we said, that glucose can secrete into the urine, and so therefore create a better environment for you to get a yeast infection. And men do get yeast infections. Yeast infections are not merely just seen in women, but men do get yeast infections. And yeast infections are not only transmitted or happens because of unprotected sex. There are other risk factors. And so these particular class of medications, again, your doctor or prescriber will explain to you, and if they recognize that you are having frequent yeast infections whilst on this medication, they will have to monitor, particularly if your glucose levels are controlled. However, you are getting frequent yeast infections. That is something that they have to closely monitor. So as we said, yeast infections are one of the complications that we see in diabetes, particularly if it's poorly controlled. You're more likely to get fungus on the skin, so you are more likely to get fungal infections of your skin. If your glucose levels are high, you are more likely to get yeast infections around the groin and in the penis and on the penis, in the vagina as well. And oftentimes, sometimes that is one of the symptoms that we may even identify to encourage someone to screen for diabetes, particularly when it is frequently reoccurring. And so, yeast infections can be linked to diabetes. If you're diabetic, you want to certainly monitor what goes on in your body. Until next time, I'm your host and pharmacist, Carlton Lando, saying, as always, your health is indeed your greatest resource. Preserve it. Have a good day from all of us from Health and Communications Solutions Limited. If you need a consultation from us, feel free to call that number 1767 285 3770. That number will tagged underneath the video. Have a good afternoon. Take care. Bye bye.